I've had issues with my bladder about 10 years.
For women with impaired detrusor contractility, or IDC, the problem isn't an overactive bladder, it's an underactive one. IDC is usually caused by neurologic disease or injury. In Tara Mitchell's case, by multiple sclerosis. So tell me what life was like before the inFlow.
My mother would help assist me in the restroom, and that would hold me back from really like going out to family functions or restaurants because I was scared to have accidents. You know, that's embarrassing.
I was actually diagnosed with MS about 22 years ago.
Before she was introduced to the inFlow, Carol Branham's IDC kept her from enjoying life to the fullest, and it started getting worse in 2014.
Constantly needing to go to the bathroom and then, half an hour later having to go again.
For Carolyn Provost, the problems with bladder control began after undergoing extensive cancer surgery.
Started then and gradually went downhill. And the signs were the leaking and just not being able to control it.
Carolyn, Carol, and Tara are among the first U.S. patients to use the inFlow, an FDA-approved urinary prosthesis made by VesiFlow of Redmond, Washington. This non-surgical device allows women to completely empty their bladders on demand. Previously, IDC required catheterization and urine collection bags, but those carry infection risks. The Centers for Disease Control estimate urinary tract infections kill 13,000 Americans every year. When it approved the inFlow, the FDA's news release stated that urinary tract infection appears to occur at a lower rate with the inFlow as compared to clean intermittent catheterization, which is the current standard of care. The inFlow, which contains a miniature valve pump mechanism, comes in 9 sizes and is inserted into the urethra the first time by a doctor. After a brief minimal training and education period, replacement devices can be inserted by the patient herself or a caregiver.
Luckily, my body accepted it rather quickly, and then of course using the activator was just wonderful because it's so fast.
The battery-powered remote control magnetically activates the inFlow's internal pump, which then empties all urine from the bladder. The first few weeks with the inFlow may require some adjustments.
For the first couple weeks, you would empty your bladder like once every 2 hours. And then it got so it could be 3 hours. And, it was even longer at nighttime.
An advocacy group for multiple sclerosis patients hailed the inFlow as a better option than catheters. For Tara, Carol, and Carolyn, just 3 of the estimated 250,000 women in the U.S. with IDC, it's about reclaiming confidence and a better quality of life.
It's just really improved my ability to live life without thinking about bladder control.
Freedom, just the quality of life, and being able to travel and being able to go shopping and, like I said, go for the walk and just being comfortable.
It's been wonderful. It's been amazing. Man, I've been going out to movies, concerts, hanging with my girlfriends and family functions, and I'm drinking. I'm like, no problem. I'm not afraid to drink, and I don't have to search out the bathroom and, worry about any leakage or anything like that. So it's been wonderful.